What happens during a colposcopy after an abnormal cervical screening? Have you ever wondered what happens during a colposcopy after receiving an abnormal cervical screening result? This procedure is an important step in understanding your cervical health. After an abnormal screening, a healthcare provider usually recommends a colposcopy to take a closer look at the cervix. This helps assess any abnormal cells or changes that may indicate potential cervical cancer or precancerous conditions. During the colposcopy, a healthcare professional uses a colposcope, which is a special magnifying instrument with a light. The colposcope stays outside the body, so it does not cause pain. To enhance visibility, the cervix may be cleaned with a mild acetic acid solution, commonly known as vinegar. This solution helps highlight abnormal areas by turning them white when viewed through the colposcope. If the healthcare provider identifies any suspicious areas during the examination, they may take a small tissue sample, known as a biopsy. This biopsy is then sent to a laboratory for detailed analysis to check for precancerous or cancerous cells. While the biopsy may cause mild discomfort or cramping, most women find it tolerable. The entire colposcopy procedure typically takes about 10 to 20 minutes and is done in an outpatient setting, meaning you can go home afterward. After the procedure, some women may experience light bleeding or spotting, which is completely normal. It is usually recommended to avoid using tampons, douching, or engaging in sexual intercourse for a short period after the procedure to allow the cervix to heal properly. Most women who have a biopsy during a colposcopy do not require further treatment. However, the need for follow-up depends on the biopsy results and the extent of any abnormal cells found. If precancerous cells are detected, treatments such as large loop excision of the transformation zone may be suggested to remove abnormal tissue and prevent the progression to cervical cancer. Colposcopy is a vital tool in the prevention of cervical cancer. It allows for early detection and treatment of abnormal cells before they can develop into invasive cancer. This procedure is part of a comprehensive approach to cervical health, which also includes regular cervical screenings and human papillomavirus vaccination to reduce the risk of cervical cancer. To summarize, during a colposcopy after an abnormal cervical screening, the cervix is examined closely using a colposcope. A vinegar solution may be applied to highlight any abnormal areas. If necessary, a biopsy may be taken for further analysis. The procedure is brief and performed in an outpatient setting, and minor bleeding or spotting may occur afterward. Follow-up care depends on the biopsy results. This procedure plays a crucial role in reproductive health by enabling early diagnosis and intervention for cervical abnormalities. Always consult with a healthcare professional for personalized advice and information.